We are back this morning with Dr. Rufus Mark of Phoenix CyberKnife Center, and we are answering some questions from viewers because, as we talked in the first segment, I can imagine when you first get that diagnosis, a lot of questions, of course, and you probably don't think of them until you get home. So let's start with questions from viewers. The first one is, what are the benefits of screening mammography?
Well, there are at least 8 major randomized trials that have proven that mammography saves lives. It reduces the mortality from breast cancer from somewhere from 30 to 50%, number one. And number two, by detecting these cancers early, the vast majority of women can preserve their breast with excellent cosmetic results. So that's the benefit.
That is wonderful. And you said when you tell the patients that, of course, that's a huge...
Oh, their eyes light up, absolutely.
Yeah, of course, that's a huge part of it. All right, question 2, what is the radiation dose from a mammogram?
Okay, the radiation dose from a mammogram is 0.4 millisieverts. What does that mean? Okay, we are being exposed to radiation sitting here right now. The annual exposure we get is 4 millisieverts. So every 7 weeks you're getting basically a mammogram dose. So it's very minimal. If you are an airline pilot, you'll get 10 times that, or if you're a flight attendant. Why? Because you're flying at altitude above the ozone layer, which protects us from radiation. So there's no real reason for women to fear radiation dose from a mammogram.
Yes, so the exposure certainly does not
trump
getting it done.
Absolutely.
All right, so our next question, what is the benefit of bilateral mastectomy?
Well, if you're Angelina Jolie and you have this BRCA1 and 2 mutation, you've got a very high risk of getting breast cancer in both breasts, about 90% over the course of a lifetime. A woman who does not have that, the risk is about 8%. So the only women who benefit from bilateral mastectomies are people who have that gene, and it's less than 1% of all women, so it's a very small percentage.
And when she did this, it was very, I mean, it was huge. It made national news.
Yeah, and that's the unfortunate part, because women in general fear it now.
Of course.
And there's a lot of unnecessary bilateral mastectomies being done. In fact, the American College of Surgery commented on this at their annual meeting back in 2013, saying pretty much exactly what I've said, that the vast majority of women do not benefit from this. More than 99% do not benefit.
Well, she raised awareness, that is for sure, and got the conversation, the dialogue going. Okay, our next question, what are the breast preservation treatment options in breast cancer? How good are they?
Well, I'll answer the second part first. Identical to mastectomy, and this started roughly 30 years ago, where 6-week programs of external radiation were compared to removing the breast. Same cure rate, same survival, even the same recurrence risk. Same recurrence risk in the breast after radiation versus recurrence on the chest wall after a mastectomy. More recently, we've been able to give these radiation courses a lot faster. So instead of 6 weeks, we can do it in 5 days. We were talking about CyberKnife earlier. That's the next thing on the horizon, that we'll be able to use CyberKnife to treat women non-invasively and get them done with their radiation programs a lot faster.
And very quickly, our last question, what is Oncotype DX?
Oncotype DX is a genetic test on an actual cancer, and the importance of it is if a woman has a low score on the Oncotype, there's no need to give her chemotherapy because there will be no benefit from it. So it's a very powerful way to spare women the toxicity of chemotherapy. If they're not going to benefit from it, then why would you give it? Oh,
that's really interesting.
Yeah.
Dr. Mark, thank you so much.
Well, thank you.
Very great information that you just gave us this morning. We want to give you some information now. If you have any questions for Phoenix CyberKnife and Radiation Oncology Center, email them at info@pcroc.com. They're at 4611 East Shea Boulevard in Phoenix. Call 602-497-0605. That's the number to book an appointment, or you can visit them online, phoenixcyberknifecenter.com.